teaching basic life support. This is not a accredited course which allows you to have a basic life support certificate that you can be a first aider at your workplace. But however, the principles, the course, the teaching, the practice, the mannequins are all exactly as it would be on an actual course. But because we are not accredited, you get a certificate of attendance to say that this is something you've done as a part of a portfolio. If you did want to use it as, for applying for a job or for to show experience of having some know-how, but it doesn't make you a qualified first aid. So I want to start off by asking the sisters at the back. Can you guys hear me okay? Mic closer or further away? Is it too much echo or is it okay? Alhamdulillah. Okay. So first of all, I'll introduce myself. My name is Dr. Hamad Ahmed. I'm a GP by profession. I have a salaried role, which means that I do various things. And one of them is teaching. So I'm also a lecturer at Queen Mary University. Dr. Farheen, Bismillah, come sit next to me. And I've got other people who are supporting me in delivering the event. So first of all,
Hafiz Mudassir Imtiaz. Hafiz Mudassir Imtiaz.
I was asking for a Hafiz. Allah SWT has given me a Hafiz. MashaAllah.
Yeah. So my name is Hafiz Mudassir Imtiaz. Currently, I'm working as a GP assistant in one of the practice in Rainham, and I volunteered at Lima. So that's it.
And there's two sisters as well who are healthcare professionals who will be leading the course on the sister side. I don't really have a mic back there, but if you'd like to introduce yourselves. Fantastic. So we've got a GP assistant, a foundation doctor, a nurse, and a GP. So we've got everything covered, alhamdulillah. So as part of the presentation, there's a small script from the Quran. Would you be happy to?
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. من أجل ذلك كتبنا على بني إسرائيل أنه من قتل نفسا بغير نفس أو فساد في الأرض فكأنما قتل الناس جميعا ومن أحياها فكأنما أحيا الناس جميعا ولقد جاءتهم رسلنا بالبينات ثم إن كثيرا منهم بعد ذلك في الأرض لمسرفون. So I'm just going to translate what I recited. Because of that, we decreed upon the children of Israel that whoever kills a soul, unless for a soul or for corruption in the land, it is as if he had slain mankind entirely. And whoever saves one, it is as if he had saved all mankind. And our messengers had certainly come to them with clear proofs. Then indeed many of them after that throughout the land were transgressors.
imagine this. You went to a shopping center and you're going about trying to get into the Asda so that you can do your quick shop and get home. And all of a sudden, you hear a commotion. And just as you look over your shoulder, you see a whole load of people who are collapsed on the floor. That's one example. Now imagine another scenario. Imagine this, that you are talking with your father, and all of a sudden your father becomes in a bewildered state where he's looking around and he's unable to explain, but he's giving you a strange look. And just as you call out to him, next thing you notice, he just. A third scenario. You're having your dinner with family, and you've got a 7-year-old child, your son, sitting next to you. He's just eaten a morsel of food, and as soon as he swallows, he starts knocking on the table. What do you do? Now, with the men, I asked how many of you would know what to do. And out of about 30, maybe 35 people, one person put up their hand to say they know how to do basic. I just want to do the same again on the sister side. Other than the two healthcare professionals, put your hand up if you know how to do basic life support already. You've done it before. I don't mean in real life, but you know what to do, basically. One person or two people. Yes? But such a simple task that we will go through today will allow you to have the skills that will enable you to be able to potentially save a life. So this is what we're here for. The purpose of doing this and making it emotive is so that you can set the scene and you can understand the context and the magnanimous nature of this task. That if you have been successful in being able to save somebody, then that would be a life saved, that would be the promise of Surah Ma'idah fulfilled, and that would be your path to Jannah. Okay? So, we move over onto this. So I've gone through what the British Islamic Medical Association is. It's a conglomerate of healthcare professionals. This is also part of a larger organization where other countries also have similar organizations of healthcare professionals, and they are also dotted all over the world, creating an organization called FEMA, Federation of Islamic Medical Associations. And we have come together with the principal idea of trying to improve the health of the Muslim Ummah and allow us to be able to advocate for ourselves when it comes to matters in unfamiliar territory. So, only 2 in 3 people in the UK would attempt CPR if they saw someone who's had a cardiac arrest. And when we say attempt, this does not mean the kind of attempt that you will be able to do by the end of this event. But this means somebody describing something to you over the phone after you've called 999 saying, do this, do that, and you try to emulate it in the best possible way. Now, 80% of people who have had a cardiac arrest, they have it at home. So this is why after Asr, the comment that I made was, if somebody collapses at home, do you know what you need to do? Because that's where it's most likely to happen. most of us will not come across somebody having a cardiac arrest. But if you were to, it's more likely that it's somebody who you know very, very well. So therefore, it becomes an essential skill. In some Scandinavian countries, this is part of the school curriculum. The child grows up learning this. The chances of somebody surviving are more than double what it is in the UK in those countries. Now, in the UK, you also have other ways after you've done cardiac arrest, had a cardiac arrest and somebody's performed basic life support, an ambulance will attend very quickly. There will be devices such as what we have in our masjid, which allow the person to be shocked so that the heart can be restarted. We have one in the masjid, by the way, for those of you who are not aware. So our mosque is one of those registered locations under the London Ambulance Service, which is a known location for somebody to be able to access a defibrillator to restart the heart. Now, if I were to turn this on its head and say, imagine wherever you may know of either yourself or family or friend who have heritage in a country which is not a developing or developed country, what are their chances? Yeah, so there's a lot of variation. But what we know for sure through British Islamic Medical Association, by doing this project, we are able to make a difference. And this difference within our community will help to raise the standard of what is possible to do when somebody does have a cardiac arrest. So, cardiac arrest is a problem with the electrical current inside the heart. This means that the electricity is not flowing the way it should be. Whereas somebody having a heart attack, which means that they may not necessarily collapse straight away, is a problem with the blood supply, the plumbing system, not the wiring system, but the plumbing system of the heart. Usually this is because of a blockage. If it's a blockage which is partially narrowing when the demand increases, we call this angina. When the blockage is complete and it's stopping oxygen getting through, then we call it a heart attack. So this is the difference in the terms that some of you may know. Now, every minute that passes by after somebody does have a heart attack, the chances of their survival go down drastically. Does anybody know what the expected time for an ambulance to attend? If you pick up the phone and say, I think my dad is having a heart attack, do you know what the expected time is for an ambulance to arrive? Average expected time in a cardiac arrest or heart attack. 8 minutes, correct. So the actual time on average is 8 minutes. Can you see on that graph where the chances of survival are at 8 minutes? 20%. Whereas if you're able to deliver basic life support, you're able to increase it potentially up to around 80%. Lots of other factors play a part: how healthy the person is, why they've had the blockage, where they've had the blockage, how many other health problems they have, how healthy their body physically is. But we are saying that in a reasonably healthy adult in their between 60s to 70s can potentially have a chances of 80%. So the difference that you can get from a community cardiac arrest or heart attack to in hospital is a 60-point difference, 60% increase, which is substantial. So now, how does my ethnicity affect my risk? We all know the answer to this. We don't need to read it. But in terms of chronic illnesses, we inherently carry a gene pool which puts us at an increased risk. So therefore, it becomes even more important. This is for those of us in this room who are of South Asian origin. If you're not of South Asian, you have slight improvement. If you're Caucasian, you have a significantly better chance than the South Asian community because of your genetic makeup. So if you have a South Asian gene pool, you carry a higher risk of lots of other conditions. And as part of that, it inherently affects the plumbing system. And this results in having a person collapse, that if they were to get basic life support in a timely manner, they would fare better off. So Afro-Caribbean have a higher chance of blood pressure problems, and Africans, Afro-Caribbeans, and South Asians are more likely to develop diabetes. But this is, again, the blood pressure and heart disease eventually lead on to a heart attack. So they're one and the same, really. What is our lifestyle like? What do we put our body through? How do we look after ourselves? Now, I'm not asking anybody to answer these questions now, but we all know the answer. Some of us may be very healthy and may be looking after ourselves, but I'm sure even those people know that the surrounding environment is not like that. And this is just part and parcel with the way that we live our lives nowadays. And we'll have the odd couple of weeks which are better in the year, but eventually this is where it leads. So, like it or not, that heart attack is coming. It's just a matter of, do you get to be in that situation where you could save a life or not? Yeah? So, just a gentle reminder that consider physical activity. Think about what kind of food and drinks you're putting through your body, and try to avoid things which you inherently know cause internal harm. We're going to start off by showing a video which shows a demonstration of how to do basic life support. And then after that, we'll go through it step by step in person over here. We'll have to fiddle with the sound, but we'll get it working somehow.
Every minute. Shout for nearby help and always check for danger. This is what a normal heartbeat looks like moments before a sudden cardiac arrest. It can happen anywhere, but you are most likely to be at home. The heart will suddenly stop beating and breathing may be abnormal or stop. Blood won't be being pumped to the brain and other vital organs. It's time to act. Every minute without CPR will significantly reduce their chance of survival. Shout for nearby help and always check for danger before approaching the person. Shout at them and gently shake or firmly tap their shoulders to check for a response. Look and listen for signs of normal breathing. Look for the even rise and fall of their chest. You could put your ear or cheek close to the person's face if you feel safe to do so. If they aren't breathing or not breathing normally, call 999 and explain what has happened. If on a mobile, put it on speaker. The emergency call handler will talk you through how to perform CPR and tell you if there is an automated external defibrillator or AED nearby. Send someone to fetch it, but don't leave the person if you are on your own. If you are concerned about any risk of infection, you could place a cloth over the person's mouth and nose before starting compressions. It's time to give the heart a helping hand. Place one hand on top of the other and interlock your fingers. Place your hands on the center of their chest and begin pushing hard. Aim for 2 beats per second and do not stop unless someone can take over. You are exhausted, the AED arrives, or the emergency call handler tells you to. If an AED arrives, this device can give an electrical shock to help restart the heart. It will talk you through the whole process, so listen carefully to the instructions. Continue CPR until the person shows signs of life, the AED advises another shock, or until a paramedic takes over. CPR gives a person their best chance at life. Learn CPR for free by playing Lifesaver at lifesaver.org.uk.
So we're going to go on to the first step of the three different activities that we'll be doing. First of all, the cardiopulmonary resuscitation.
So, in order to tell you guys about cardiopulmonary resuscitation, we need to know first that when we do it and what are the indications that tell us that this person needs a CPR. So, in order to have a quick understanding about this, what we can do is just remember the alphabetical order of A, B, and C. Okay, so A in this stands for airway, B stands for breathing, and C stands for circulation. I'll quickly tell you in detail what A, B, and C are. Okay, so for airway, so if any person is collapsing in front of you or is apparently unconscious, what you need to do, just go close and look for the any abnormal sounds. If you can hear any gurgling sounds, any snoring sounds, which are not normal if a person is conscious. Okay, and these sounds are the indication that the patient's airway, which is a passage from the mouth to the lungs, it's at somewhere at some point is blocked. So there is one thing how we can manage it. Uh, the maneuver's name is there are two maneuvers. What you can do, let's remember the easier one, which is jaw thrusting maneuver. Okay, or the second one is head tilt and chin lift. So if you hear these abnormal sounds, so firstly you have to clear the airway. Okay, and how you can do, one is jaw thrusting, which we will show you guys in detail later, and the second is head tilt and chin lift. So for example, if airway is clear now, the second thing to look for is breathing. How you can look at the breathing is if your chest is moving up and down, or if your chest is taking in the air or not. So in order to recognize this, what you need to do, there are three words to remember, which is look, feel, and listen. Okay, so you'll be going closer to the patient, and you will be looking at patient's chest, and you will be listening from your ears the patient's breathing sounds coming out of mouth or nose. Okay, and you will by doing this you will understand if the patient is breathing or not. So this will be the point. If the patient is not breathing, if you cannot look any patient's chest rise, and if you cannot feel the patient's breathing on your ear or cheeks, and you cannot listen the breathing sounds, that's the time and the indication telling you to start the CPR. So what you need to do for CPR is, yeah. So as on the slide, it says, look for the dangers. If there is any dangerous object around that person, try to remove that first. Any sharp object, anything, okay? Or if the patient is collapsing outside of the home in the community, if it is on the road and the road is very busy and no one is around to stop the cars or something, always look for your safety first, and then try to look for the patient safety, where it is safe to help the patient. Second, look for the patient response, as Hamad Bhai just mentioned earlier. We will tap on the patient's shoulder, person's shoulder, that if that person is able to respond back to us or not. And third is shout for help, which is very much important because it's always a teamwork. You can't really do everything on your own. So shout for help, and then start this ABC. Okay, every breathing and circulation, and that's the time which tells us to start the CPR. So So, and we just watched the video for the CPR. What we do, a little bit CPR. Yeah, that's perfectly fine. Yeah. Okay. So as we have done all these steps, ABC done, now is the time to start the CPR. What we need to make sure is patient is lying flat on the hard object. If it is floor, that's perfectly fine. And then, as in the video, it was saying that you have to place your hands, the palm of your hand, on the middle of the patient chest. Always try to put the non-dominating hand first, and on the top, the dominating hand. It helps with the compressions. And land your palm on the patient's center of the chest. Okay, and then you have to start compressing the chest. So there are 2 3 important things to keep in mind when you are doing the compressions on the patient chest. One is the count of the one is the way how you are going to do the compressions. First, Hamad, I will going to show you that how it can go wrong. If you are compressing the chest and bending your elbows, that's completely wrong. It is not exerting the required force on the chest. That is a wrong way of doing the compressions. So the exact and right way is holding yourself on the patient's chest and and exerting the force from your shoulders, and do not bending your elbows. So now we're going to demonstrate the right way of compressions, which is like this, and we are not at all bending the elbows. We need to make sure that. Number two is the rate of the compressions. As it was saying in the video, it should be 2 compressions per second. So nearly 100 to 120 compressions in a minute. Number three is how deep the compression should be. So apparently it ideally comes with the practice, but how in theoretical way, it should be 5 centimeters going deep into the patient's. The compression should be enough that the patient chest going deep 5 centimeters nearly. So these are things which need to keep in mind. And rest is always keep in mind, we always do the compressions and breathing simultaneously. So in adults, what we do, we keep in mind the 30:2 method, which means 30 compressions and then 2 breathings. Give 2 breathings to the patient. So would you? Okay. Yeah. Okay. All right. So we are just doing the compressions here, and we are waiting for the help to arrive, and then we can start with the AED.
Help me?
Yeah.
I've got an unresponsive person. I don't know what's happening, but you can also ask them for a defibrillator. Oh. Is this okay? Oh, okay. Try not to shout now. Where was I? So airway, you would put them into a recovery position. Now, we will be covering that later. So by putting them into a recovery position, it allows their mouth to look sideways, looking downwards, and anything that's inside can come out. After you've made sure that the mouth is clear, the airway is now patent. Now you can move on to the next step. If you can hear any gurgling and there's still stuff stuck inside, but you cannot do anything about it, you move on to the next step because you've done everything that you could have done. So for the breathing, as mentioned by Dr. Hafiz before, that head tilt, chin lift, and you put your cheeks as close to their mouth as possible while looking at the chest. So like this. It is recommended to stay in this position for 10 seconds. While you do that, you're looking, you're feeling, and you're listening. I forgot myself. So you're looking to see, is the chest rising? You're trying to feel for any breath on your cheek, which is a sensitive area of your face, and you're trying to listen to see if you can hear any breath sounds. After you've done that for 10 seconds, now you have acknowledged the fact that this person is unconscious and this person potentially may not be breathing. If that is the case, you start doing compressions. If they are breathing, then you do not need to do compressions. You need to put them into the recovery position, which is the same as what you would do if the airway is obstructed. Make sense? So on the presentation for C, it said circulation. If you're a medical professional, there's an extra part which we are not going through. So for the public, the C is for start CPR. The acronym itself is circulation, but we have changed that for the public by the Resuscitation Council of UK to be for doctor is danger, response, shout for help, check the airway, check the breathing, and if it's not there, you start CPR. Okay? As mentioned before, if I can just go through it one more time, put your dominant hand on top, your non-dominant hand at the bottom, put the two together and form, lock your fingers in. Make sure that you are not trying to do this with bent elbows. The amount of force you can put through is not as much as if you put your whole body weight into the movement. Because then you're not using your muscles to push away, you're using your shoulders and your back to push. So this device has a small central area which, if enough pressure is put onto it, it makes a click sound. So if I do this, and I'm not isolating the pressure in the middle, it doesn't make a sound. If I do it even in the middle, but I don't do it hard enough, it doesn't make a sound. It requires a significant amount of force, unless if this is a 90-year-old frail person who only weighs 45 kilos, you will need to use a significant amount of force. Now, Dr. Hafiz mentioned that it should be 5 centimeters. What happens if this person is large, if they're obese? The recommendation is that then you start to think more in terms of the depth of their chest cavity. You need to go a third of the way down, which means that it's extremely tiring, and it's difficult for one person to do anything more than a minute. 2 cycles of doing compressions, and then you change over and you keep doing that in order to maintain enough circulation in a hospital setting. So in the community, it's much harder. So now that you've started doing this, you will ask for, should we do the AED now? Yeah. So you will ask for the bystander to come back with the device after the ambulance 999 have told them where to go and collect it from. So for those of you who may not be familiar, just as soon as you enter the masjid, there is a yellow orangey box on the top of the bookshelf, looking directly at the front door. And that is the AED, which is stationed at this masjid, registered with the London Ambulance Service and available for people in the community to be able to access. It is a device which has its own licensing, it has its own checks which the masjid has to perform, and the pads are replaced so that it's made sure that they're always in date. So it is an approved device and is dangerous. Please only use it as per advice from the London Ambulance Service. When you get the AED, it comes with a small screen, an on button and a shock button. It's as simple as that. With this device, you get a cable and 2 pads which can be attached. These pads are put onto the chest and the pictures on the pads show you where to put them. One pad goes directly in front, a bit to the right, and the other pad goes on the left, horizontally, just below the breast area. So the 2 pads go on like this. When you try to do it, you will see that there is a sort of a dummy AED, and it shows the pictures of where to stick them. Stick the pads on, press the on button. The device will then give you instructions. First of all, it will say it's assessing the rhythm. Please stop CPR, which means you need to take your hands off. There's a risk of electrical shock. Press the button, and it will deliver the shock. And then it will say recommence CPR. Okay? So it will give you simple instructions, and you follow that. If there's any confusion, 999 are still on the phone and they stay with you. This is quite complex. It's complicated. There's lots of steps to it. And that's why the only way that this works is if people actually try to do it themselves. So at this point, before we move on to the next step, which is that this person does start responding, they do start breathing, they do start groaning, you put them into the recovery position, which we'll do after we've practiced this step. That sound like a plan? Okay, we've got, we need, yeah? Correct. There is a big chance in a person who may not be healthy or strong, but I don't mean strong as in muscular, strong as in just have a skeleton which is reasonably healthy. There's a high chance of breaking a rib, and this is a risk that you are willing to take to restart the heart. Many of us may have had family members who, near the end of their life, have a piece of paper put in their record to say that it's not preferable for my dad or granddad to have CPR performed because the risk of the amount of damage that you will have multiple broken ribs, it is not worth doing. So this is the reason for why in very elderly patients or patients who are very unwell, patients who have terminal disease, patients who have a end-stage disease like end-stage heart failure or lung failure, they will often have these papers put into their records so that if an ambulance comes or if there's a family member at home, they do not perform CPR because the chances of them recovering to anywhere near where they were when they do have the heart attack or cardiac arrest, it's just not plausible for this to be a viable option. Correct. So you fall back on the principle of a third of the chest, with a child between the ages of, I believe it's 4 to 12, you use one hand. Under 1 to 4, you use just the fingers, and under 1, you just use 2 fingers. So but this is something which is hard to remember. It's better if you call 999 and get the advice directly at that moment in time. Yeah? No. It has to be directly on skin. And if it's a hairy chest, those hair may impair the ability for the pads to deliver the shock. We're talking about a very hairy chest. So often you'll, if you've had a family member who's gone for an ECG to the doctor or at the hospital, they will shave the chest in order to put the pads to measure the electricity. Same principle, electricity coming in or out, it requires direct contact. Sorry? Say that again? You mean at home when there is this situation? In a hospital, we would. At home, you're not expected to carry a. The AED boxes normally do carry blades, but in that situation, it really depends on what is possible, what's not possible. If you have enough people around, it will be possible. But if it's just you and another person, there's not enough capacity to be able to think about doing anything more. You can change the position, but that's something that 999 will tell you, that if the pad is not getting good contact, what you need to do. So you can do front and back. So in children, we actually do front and back. You can do the same in adults. It's just not as effective in adults, but it is possible. Or side to side as well. So there's various ways that it can be done. No, it's 999. A machine tells you that there's no contact, but it doesn't know if there's no heartbeat or there's no contact. You have to see and set up yourself. Any other questions? Any questions from the sisters? Oops, that's too loud. So let's break up. We've got 2 of these dummies at the back and 2 at the front. So the brothers can divide into 2 groups, one on this side, one on that side. And we've got, there'll be a trainer with each dummy so that you can have a go and see what it's like. Okay? So I've put some of these rolls here. So if you wanted to practice the whole thing, you can just pretend that this is a collapsed person and try it on here. But for the clicking sound and to know whether you're going deep enough or not, those devices are what's licensed for being able to know. Okay? So if we divide into 2 groups, and let's give it a go. Are you okay with that side? Right?
Oh.